Malaria is a life-threatening disease primarily found in tropical countries. It is both preventable and curable. However, without prompt diagnosis and effective treatment, a case of uncomplicated malaria can progress to severe form of the disease, which is often fatal without treatment. Malaria is not contagious and cannot spread from one person to another. The disease is transmitted through the bites of female Anopheles mosquitoes. 5 species of parasites can cause malaria in humans, and 2 of these species, Plasmodium falciparum and Plasmodium vivax, pose the greatest threat. There are over 400 different species of Anopheles mosquitoes, and around 40 known as vector species can transmit the disease. This risk of infection is higher in some areas than others depending on multiple factors, including the type of local mosquitoes. It may also vary according to the season, the risk being highest during the rainy season in tropical countries. Nearly half of the world population is at risk of malaria. In 2021, an estimated 247 million people contracted malaria in 85 countries. That same year, the disease claimed approximately 619,000 lives. Some people are more susceptible to developing severe malaria than others. Infants and children under 5 years of age, pregnant women, and patients with HIV and AIDS are at risk Infants and children under 5 years of age, pregnant women, and patients with HIV and AIDS are at particular risk. Other vulnerable groups include people entering areas with intense malaria transmission who have not acquired partial immunity from long exposure to the disease, or who are not taking chemopreventive therapies, such as migrants, mobile populations, and travelers. Some people in areas where malaria is common will develop partial immunity. While it never provides complete protection, some people in areas where malaria is common will develop partial immunity. While it never provides complete protection, partial immunity reduces the risk that malaria infection will cause severe disease. For this reason, most malaria deaths in Africa occur in young children, whereas in areas with less transmission and low immunity, all age groups are at risk. People who have no partial immunity to malaria are at higher risk of contracting the disease. This includes travelers from non-endemic countries entering areas of high transmission, as well as people in malaria-endemic countries living in areas where there is little or no transmission. As symptoms often do not present for 10 to 15 days after infection, travelers may return to their home country before exhibiting signs of the disease. Doctors in non-endemic areas may not recognize the symptoms, causing potentially fatal delays in diagnosis and treatment. In addition, effective antimalarial drugs may not be registered or available in all countries. Chemoprophylaxis can be used as a preventive therapy prior to traveling in endemic areas. When combined with the use of insecticide-treated nets and the repeated application of a topical repellent to prevent mosquito bites, it significantly lowers the risk of infection.